Hello there. My name is Kiirtaara Aravindhan. I'm a PhD student from University Malaya. I will be presenting on quality of life among older adults during the COVID-19 pandemic, a prospective study on behalf of my colleagues Moses Raj Murali, Sumaya Mat, Mopintan, as well as all ageless investigators. The recent COVID-19 pandemic has resulted in an imposition of a nationwide lockdown on the 18th of March and has since been ongoing via implementations of the conditional MCO, the recovery MCO, and enhanced MCO based on trends of infections. Though it has been hard on all of us, the lockdown imposed has been especially difficult on vulnerable groups, which includes adults aged 60 and above. As such, it has definitely resulted in an obvious impact towards older adults' quality of life. The scarcity of research imploring quality of life among older adults within the Malaysian context has led to the aim of this research, which was to determine the effects of lockdown measures and the pandemic on older persons' quality of life in Malaysia. Literature has shown that older adults have been significantly impacted by the pandemic, not only due to high mortality risk, but also forced or voluntary confinement associated to lockdowns based on their respective countries. This lockdown has resulted in observed or foreseeable impacts, which includes changes to physical and mental health, and the World Health Organization have warned that these impacts could be large and enduring, especially in terms of mental and psychosocial well-being. There has also been an obvious impact on quality of life due to the aforementioned factors. Decrease in quality of life among older adults has been observed during the pandemic in comparison to prior reported quality of life. COVID-19 has significantly altered day-to-day living among older adults as per restrictions and recommendations imposed by their respective government. So, for our methodology, participants were recruited from the Malaysian Elders Longitudinal Research (MELO) cohort. Participants were aged 55 and above and were recruited from the electoral rolls of Lembah Pantai and Petaling Jaya Utara as well as Petaling Jaya Selatan. Baseline data collection was conducted in between 2013 to 2015, while the follow-up data collection was conducted in September 2020, 6 months after the beginning of COVID-19 pandemic in Malaysia. For the instrument, we used the 12-item Control, Autonomy, Self-Realization and Pleasure questionnaire, fondly known as CASP-12. CASP-12 is a Likert type scale ranging from 1, which denotes often, to 4, which denotes not often. Total score ranged from 0 to 36, where highest score meant higher quality of life. In light of the pandemic and social distancing, the instrument was virtually administered via an application called RedCap. Enumerators were recruited to administer the questionnaire to the participant. Each participant took approximately 10 minutes to complete the questionnaire. For data analysis, we used IBM SPSS statistics. We ran descriptive analysis, independent t-tests, and chi-square analysis to observe mean differences, and we did a paired sample t-test to observe differences between items in wave 1 and items in wave 2. So, on to main findings. From our findings, there was an increase found for 9 out of the 12 items. The 3 items that reported a decrease from wave 1 to wave 4 was my age prevents me from doing the things I would like to do, I feel that I can please myself in what I do, and I enjoy the things that I do. A little bit of demographic details. So 56.8% reported an increase, which totals up to 404 of our participants, whereas 43.2 reported a decrease, which amounts to 307 out of 711 participants. The mean age was 73.8, and among all demographic variables, only ethnicity was significant. For males, most reported an increase, while for females, most also reported an increase. Among ethnicity, Malays reported more decrease than increase. Chinese, Indians, and others reported an increase more than decrease. For marital status, all reported an increase more than decrease. As for educational level, it was similar between increase and decrease for no formal education. Primary also approximately the same. For secondary, more reported an increase than decrease. Post-secondary reported more increase than decrease, and university also reported more increase than decrease. Based on our results, it was found that older adults felt more out of control, more left out, and short of money. In terms of feeling more out of control, the COVID-19 imposed lack of social activity resulting in lack of social support may have played a part. The reason why the older adult may have felt more out of control is because they could not resume with their daily activities, lacking social support. Study by Khan and Tahir found that being socially active was significantly associated with an increased quality of life scores. Elderlies who actively participated in social activities were able to develop good social networks and integrate into society, therefore preventing social alienation. So, the COVID-19 imposed lack of social activity, in fact, more of restriction of social activity, therefore resulted in a lack of social support received. Social support is an important component required for improving quality of life, especially among older adults in Malaysia, as per study by Mohammed et al. So those who could not participate in their usual social activity did not receive the kind of social support they usually received, which is why they probably felt more out of control. In relevance to that, most of our participants also reported feeling left out more than usual. Loneliness could be a factor. As above, COVID-19 imposed could have resulted in loneliness, which is why most reported feeling left out. In line with these findings, another study found increased loneliness in 2020 compared to previous years. Loneliness reported was higher during lockdown compared to subsequent reopening phase, particularly among older adults who lived alone. As for those feeling more short of money now than they did a few years back, there has been profound consequences for the economy and financial market in Malaysia, as we all are already aware. So it is no doubt that they may have felt short of money despite incentives being given by the government. From the results, we also saw that most of them reported an improved quality of life over the pandemic. So, for this, a study by Herrera et al. Has found that during the COVID-19 pandemic, older adults showed improved resilience resources and social networks. That means they were well aware of the available resources and were well connected socially, which is why they could have reported an increased quality of life. Ethnic differences was also found as an associated factor. Various literature has reported ethnic differences as an associated factor. This could be due to differences among ethnic groups in biological, demographic, social, environmental, psychological, or behavioral characteristics. Another possible reason that has been reported by literature is due to life cause effects, with the cumulative compounding of disadvantage originating from an experience of structural, institutional, and interpersonal racism. In simple terms, their experience being part of that ethnic group may have resulted may have impacted their quality of life, which is why ethnic differences is reported as a significant associated factor. So, from the findings, we strongly encourage that strategies to mitigate effects of the pandemic should address ethnic differences as an associated factor. How this can be done is probably through virtual group meetings, virtual connecting sessions across ethnic groups, and not for a specific group of ethnicity. Strategies should also tackle the findings that older adults felt more out of control, left out, and short of money. There are various virtual means to address older adults feeling out of control and feeling left out. The recent pandemic, most of us saw very creative efforts to connect with each other. Similarly, it can be done for older adults as well. In terms of short of money, perhaps we can explore assisting older adults via more incentives aside from the ones currently being provided by the government. So that's all from me. I would like to acknowledge that this research is funded by the Ministry of Higher Education Long-Term Research Grant for the Ageless Longitudinal Research Project. We'll also like to convey special thanks to all ageless investigators involved. Thank you. Any questions, feel free to comment.